can heart failure be prevented by treating comorbidities?
In most patients, probably yes, or it can be slowered, because majority of patients get heart failure due to extracardiac or extramyocardial reasons, because the leading causes of heart failure are coronary artery disease and hypertension. So if you prevent coronary artery disease and if you diagnose and properly treat hypertension, you could prevent many cases of heart failure, that's for sure. And that is very challenging, not only for cardiology community, for hypertensiologists, for nephrologists, internists, but for entire medical community. And I'm accentuating general practitioners, which should be aware of that, because it is a very important task that could influence epidemiology of our nations in a good way.
And how much ageism and sexism are common in managing patients with heart failure, and how to minimize these behaviors?
You know, we doctors are supposed not to be neither ageist, not sexists. All the patients should be equal for us. But this phenomenon sometimes is present in our everyday practice, not on purpose, because there are some well-known differences in behavior and in symptoms between women and men. Not only in hypertension, but particularly, for instance, in the case of coronary incident, atypical clinical picture is more typical for female gender, and we know from registries from our everyday practice that because of that many women are late diagnosed and worse treated than men because of their atypical presentation. And regarding the age, there are some differences. In some circumstances, we could even argue if there is an ageism in the bad manner, because you know, in many national health systems, we need to be rational as much as possible, and contemporary medicine is very expensive. So we try to balance between our financial possibilities and our wishes. That's the first thing. Then you always have a higher risk in older people, whatever you do with them. If you do any invasive procedure, if you implant them with left ventricular assist device, or even if you think about transplantation, your outcomes are going to be worse than if you deal with the younger population. Therefore, some centers, some hospitals, some doctors are prone to give priority to young patients that have better prognosis and that can assure better response to our treatment possibilities. But regardless, I think that ageism is not something which we should tolerate, particularly due to the fact that the population in the Western world is growing old, and we are facing more and more old people that desire proper treatment, and proper treatment means optimal treatment according to contemporary evidence-based medicine and guidelines.